We're seeing a lot of gout. We're seeing a lot of 60 and 70 something males with gout. We're seeing gout in women in this older age group where gout was almost unheard of in women 15 or 20 years ago. Gout's fairly prevalent in women now, particularly women who are in their 70s and 80s. So, and women develop gout in a way that's different than men. So they tend not to have the acute presentation of the big toe swelling. They tend to have much more indolent disease. So yes, we're seeing more patients with gout. We're seeing more patients with comorbidities. And gout is one of the comorbidities that accompanies the hypertension, obesity, diabetes, hyperlipidemia that is so prevalent in this population, in this country's aging population. There's a factor that isn't addressed here, and it isn't necessarily responsible for the increased prevalence of gout, but rather seeing gout at later stages in the patient's disease, and that is that we're not screening patients for their serum uric acid levels until they present with a disorder that is compatible with gout and the suspicion is raised. We used to, with ordinary chem screens, look at uric acid levels, and now it's an afterthought, and only when the physician specifically is looking for gout do they see it. I wouldn't treat every patient who's had one gout attack. I would see the hyperuricemia as an intro to other aspects of that patient's milieu, as we talked about, the hypertension, the heart disease, the hyperlipidemia, the diabetes. And so I looked that patient over fully. I wouldn't treat an elevated uric acid in the absence of a history of repetitive attacks of gout. But once the patient has established a pattern of repetitive attacks, and the serum uric acid level is elevated, that patient should be on treatment. The second thing I would want my primary care colleagues to know is that if you're going to treat hyperuricemia, then the goal is to get the serum uric acid level down low enough so that you can mobilize the monosodium urate crystals that are at the root cause of gout. So a serum uric acid level of 6 milligrams per deciliter or less is the target, no matter what the patient's renal function is. If they need to be on a uric acid lowering drug, then your goal is just one thing, and that's to get the serum uric acid level down to 6 or less.